And we're back, and we're moving into our second conversation for this morning. We are talking about some of the high-risk behaviors associated so far with COVID-19. Dr. Figueroa was very clear in telling us, remember, there's certain things that we're just not sure of as yet. But we are joined at this time by the Director of the National Drug Abuse Control Council, Esner Vellos, to talk about these high-risk behaviors. Good morning.
Good morning, Marlene. Good morning, Gavin.
Yeah.
Good morning, Belize.
Yeah.
And we're here to speak about the effects that smoking and alcohol consumption has on COVID-19, right?
Yeah.
And these are things that we, throughout the work of the National Drug Abuse Control Council, we have been emphasizing the general public to reduce consumption of tobacco, to reduce consumption of alcohol. And in this point in time, it's when we really have to make sure that we take this into consideration, because as you can see, the literature has been saying that the effect that alcohol has on and tobacco have on COVID-19 is very alarming.
Esner, we know one thing, and I'm saying it anecdotally and not based on scientific research. We as Belizeans, we drink very often. We drink socially, we drink when we're bored, we drink when we're celebrating, we drink when we are mourning. We drink because it's Thursday or Friday or Saturday or Sunday. We drink because we're home, because there's nothing else to do. And so I would venture to say that a lot of people right now in the state of emergency, they may not be drinking to get drunk, but just to be able to even settle themselves during the day.
And
so we're talking about a behavior that I'm sure people are just saying, what do you mean I can't drink right now? What do you say to them about how it impacts their risks?
Again, drinking alcohol in general undermines your immune system. It weakens your immune system, right? And imagine you having a weakened immune system and you contract COVID-19. And you know that once you contract the virus, there isn't any medication that will be able for you to assist your body to be able to fight the virus. And with a weakened immune system, then it compromises your body and your health even more. And that also happens with smoking tobacco, because we all know that these substances, for example, in the case of tobacco, it compromises your respiratory system.
Absolutely.
And we know that COVID-19, the first thing that it affects is your respiratory system. And whenever you're smoking, you have pulmonary disease, you have pneumonia, and these other diseases that affect your body. And if you catch the virus, then the probability that you would need a ventilator is very high. So that is why the National Drug Abuse Control Council is sending the call out to the general population that at this present time that we are very careful in terms of consuming alcohol and consuming tobacco. We have 30 days that we have been given. In these 30 days, our concern is to make sure that the general public changes their lifestyle. Because, and this is one of the things that is being talked about a lot during this period, right? Changing our lifestyle, eating healthy, making sure that we wash our hands, maintain social distancing, but also include in all these preventative measures the reduction of the consumption of tobacco and the reduction of the consumption of alcohol.
From the data that you do have, what's the situation when it comes to people who smoke and also people who drink excessively in Belize?
Well, we have to look at it in two ways, right?
Okay.
The effect that it has on your body, but also in terms of the effect that it will have that you would transmit the virus.
Okay.
For example, if you're smoking tobacco, the mere fact that you're taking a cigarette in your hands and putting it in your mouth, it's one of the reasons
That's
why.
your touch your face.
That's your touch your face.
Right.
You're touching an object that can potentially have the virus. Now, factor into that cigarette that you've touched is also shared by someone else. Then that means that,
like if it's marijuana, like if we're sharing
exactly,
marijuana,
or you're sharing hookah or you're sharing e-cigars, then the probability of you contracting the virus is high, but at the same time of you sharing the virus or transmitting the virus to another person is also very high. So that's the reason why we at the National Drug Abuse Control Council have joined the work that is being done by the Ministry of Health to make sure that we can also contribute to the reduction of the transmission of the virus through these substances, right?
Yeah.
Now, when you're looking also at alcohol, you open a bottle of beer,
Yeah.
you throw it in a cup, you drink a sip, you share that cup with someone else. Again, that's another avenue of transmission.
Yeah.
Or even if you're sharing a bottle of rum or a bottle of wine.
Everybody touches it.
Everybody touches it.
Yeah.
So we have to really be cognizant of the fact that there's two ways that we can be impacted by the virus when it comes to tobacco consumption and alcohol
So
consumption.
we're not even talking about how we use it. We're talking about the fact that we may be socially distanced, but
yeah.
we're touching the same object in between.
Exactly.
Whether it's the bottle of wine, rum, marijuana, or whatever else that we're sharing.
And also, let us dispel the
I didn't
the
think of that.
myth that alcohol cures the virus or kills the virus. It is not so. The
Yeah.
consumption of alcohol has no effect on on the virus itself. But if you use alcohol to wash your hands or to clean your hands or something like that, then it might work, right? But in terms of consuming the alcohol, that's a myth. It doesn't work.
And to kind of piggyback off of Marlene's earlier question, do we have sort of an idea in terms of like numbers of persons who are like actually at risk in term, and I mean people who are like maybe chronic users of alcohol and tobacco? Do we have an idea, at least in the country, of how much like the size population
Yeah.
that we're looking at?
Based on our statistics at the National Drug Abuse Control Council, we see approximately 400 clients on an annual basis. Of that 400 persons, about 50% are chronic users of marijuana. Then it is followed by consumers of alcohol. So we have a very large population who consumes marijuana, who consumes alcohol, and also followed by the consumption of tobacco, right? And this conversation that we're having is conversations that we've been having for quite a while. But this is the time for us to reinforce the message that the National Drug Abuse Control Council has been giving out so that the general public can understand the level of risk that they have when it comes to the consumption of these substances.
So, in the United States, they were seeing a lot of hospitalization in younger populations. And one of the things that they are saying, maybe, because we still don't have
Yeah.
all the research, it could be the vaping that the younger population is doing.
Yes.
There's no guaranteed link here. That's just one of the things they're looking at. So you're not just talking about traditional cigarettes
Yeah.
or marijuana. You're talking about some of the newer technologies as well.
Like windpipes, hookahs,
E-cigarettes.
But even though there isn't scientific evidence that there is an effect on it, it's better to err on the side of caution, right? Because we're in a country where we have limited ventilators,
Yeah.
right? And we have to make sure that we, as citizens of this nation, we can also take heed of making sure that we are doing our part to make sure that we don't have to use that ventilator in the event that we have the virus, right? So I want to make sure that I emphasize, especially with young people, this is the right time. This is the time for you to make a change in your lifestyle. And to make sure that you don't only reduce your consumption of smoking of cigarettes, but also in terms of smoking non-traditional substances and also that of alcohol.
So I think that the link is easier to draw with smoking and tobacco products because people know. I think there's like general knowledge. It's bad for your health. It affects your lungs. So even if you don't link it, if you're doing something that's going to make your lungs weaker or not as strong, and you have to fight off a disease that will primarily affect your lungs, that's definitely putting you in bad shape. So I think that even if there is no link, there's always a proper excuse to not encourage that type of behavior. But we don't see that with alcohol. I think people don't think of how alcohol may actually affect your immune system and your internal organs.
Yes, in many ways it does. I mean, first we have to understand that alcohol inhibits your immune system. We have to part from that era, right? But at the same time, when you consume alcohol, you're also minimizing the function of your liver, of your kidney, of your cardiovascular system, right? So all of that, when you're compromised with the virus, the probability of your body to be able to fight the virus increases drastically, right? So we have to make sure that we do the parallels when it comes to alcohol consumption, right? But added to that, it's 30 days that people will be at their house, for example, right?
Yeah.
And it's 30 days where people, and we're at this present time having a lot of uncertainties, right? A lot of anxiety is building up, and a lot of depression is also there because there are a lot of people who don't know where they will find the next meal because they have lost their jobs. And most of them will search for alcohol to solve, quote unquote, the problems that they have.
Yeah.
But then that brings in another layer to the whole issue of how alcohol affects COVID-19 in terms of the increase of domestic violence, the increase of, in terms of how an individual who is at home consuming alcohol will have that effect on the kids, right?
Mm-hmm.
So we have to make sure that when we're talking about alcohol and the effect it has on COVID-19, we don't only look at the health aspect of it, but also in terms of the social aspect.
And I also wanted to ask, in the case of both alcohol and tobacco and other substances people smoke, a lot of the times these are chronic habits, and in many cases, people have been doing it for years, and it's going to be very difficult for them to make that break in these circumstances. But I'm wondering if you have any sort of advice for those persons who might be listening to, are saying, all right, well, they recognize that, the disease can have this effect, but, I've been smoking for 10, 20 years. So do you have any advice for somebody like that? What can they do, or if there's any resources they can access?
Well, one, the government has given us 30 days
Mm-hmm.
to really sit down and think, not only in terms of changing our lifestyle in terms of consumption and alcohol, but changing our overall lifestyle in terms of health management, right? Two, they can access services that we provide at the National Drug Abuse Control Council. Right now what we're doing is tele-outreach, meaning that they can call our offices, and through our outreach case workers, they will be able to advise them in terms of what to do, what not to do, where to go in terms of seeking help.
Yeah. What other advice are you offering to people? I know you know that the challenge of breaking some of these behaviors that we just don't think, like the consequences of things like alcohol consumption and even smoking, it's not immediate. It's it's like when you have liver failure or you have damaged lungs, it's way when it's too late. So how do you get people to understand how in the context of COVID-19, it's an opportune time?
It is an opportune time because this is where you would realize that you do not have the virus, or you do not contract the virus. The opportunity to be able to change that mindset that you have, right? We live in a society where alcohol is very much present in our day lives, as Marlene had said earlier, right? But we need to be conscious that whether COVID existed or didn't exist, the effect that alcohol and tobacco or any other substance have in our day-to-day life and on our health is very big, right? In terms of if you compromise your health system, right? The amount that it will take, or the financial implications it will have for you to be able to cover the expenses to take care of something that you could have merely avoided from the onset if you would have reduced the consumption of tobacco and alcohol, right?
Now, how do people get in touch with you? Where are your offices?
Well, one, you can call the MOH hotline, 0800 MOH Care, where they will be able to channel you wherever you need to go. And we also have a specific assigned number right now at the National Drug Abuse Control Council, which is the 227-1121 number. Once you call that number and you request any type of assistance, then the person that is answering the phone will be able to channel you to our different district offices, where our outreach experts will be able to guide you and to assist you in whatever needs you may require. We're also working very closely with the rehabilitation facilities, where individuals will be able to go and make sure that they will be able to get the services that they require. And also, if you are not able, because of the distance that you might have in terms of reaching out to a National Drug Abuse Control office, you can always go to your nearest medical health facility where there will be a psychiatric nurse practitioner that will be able to also guide you during this time of need.
You know, these types of habits are considered coping mechanisms, unhealthy coping mechanisms. And in a time where things are just so out of sorts, it's really hard for people to just imagine that you're saying, you know, stop completely. Is it a matter of perhaps weaning off? Is there an I mean, people may be saying, well, I want to have a beer here or there. Is it that is it that you shouldn't, or it's how often and how much?
Well, we have to realize that stopping an addiction is not an overnight thing.
Thank you. Yeah.
Right? It takes its time. But more than time, it also takes willingness on your part to want to make the change, right? So what we are advising the public that does consume any type of substances, because today we're only talking about tobacco and alcohol, but there are other substances that also compromises your immune system that would contribute to a higher level that COVID might affect your body. Stopping the consumption, like I said, requires a lot of will, right? But when there's a will, there's always a way. And when you want to change your lifestyle, you always find help, right? And that is where the National Drug Abuse Control Council and all the other agencies within the country of Belize are here to provide that service to you.
So if someone wants to take a beer for the weekend, just one on the weekends, that's fine?
That's fine, but once you do not abuse. You see, that's the whole thing when it comes to substance abuse or the myth that there is behind the consumption of alcohol or the consumption of tobacco, right? That people do not know when to stop. And that's the key thing here. You need to know what are your limits, and you need to know when you are already in a position where you are inhibiting not only your physical ability to be able to do things the right way, but also how that affects your loved ones, affects a community, and all that.
Just one night a week binge drinking is a problematic behavior.
And the message that the National Drug Abuse Control Council is sending is that it is our hope that people stop smoking, and it is our hope that people stop consuming alcohol. But we know that doesn't happen overnight. But what we're saying is that because of COVID-19 and the effect that it has on tobacco consumers and alcohol consumers, reduce the number of cigarettes that you're smoking, reduce the number of weed that you might be smoking, or alcohol.
Or frequency too.
And the frequency, so that in the case that you do get the virus, that the probability of you needing that ventilator is lower.
Okay. Well, any final advice to people? If somebody watches and says, okay, fine, this is the time. You said support over the phone. There are rehabilitation programs in the country for alcohol and drugs.
Yes. And also we have the psychiatric nurses countrywide that will be also be in a position to provide that help to everybody. This is the time, and this is the message that the National Drug Abuse Control Council wants to make heed of, right? Apart from the social distancing that the Ministry of Health is asking for us to do, the constant washing of hands, the changing of lifestyle, reducing the consumption of tobacco, reducing the consumption of alcohol, eating healthy, but also taking care of our mental health at this present time.
All right. Well, thank you for coming in, Esner. We appreciate it, and it's a great reminder that if we want to have our immune system in optimum shape, we also have to look at the bad behaviors and bad practices we have as well.
Exactly.
Thank you. We're going to go ahead and take a break, and when we come back, we'll be looking at the state of emergency regulations with attorney Audrey Matura. Stay tuned.